the worst medicine that destroys your brain over time. You might be taking a medicine right now that is slowly destroying your brain. No, this is not an exaggeration. It's a frightening, silent reality affecting millions of people every day. Common medications may be directly linked to memory loss, mental confusion, and slowed thinking. And the most shocking, many of these drugs are sold over the counter. They're in pharmacies. They're in your cabinets. They're in the routine of someone you love. In this video, you'll discover the 16 most dangerous drugs for your brain. And we're not talking about illicit drugs or exotic substances. We're talking about common, everyday prescribed medications. Shall we begin? Number 16. Diphenhydramine. Have you ever taken an antihistamine to sleep better or relieve itching and sneezing? Diphenhydramine, found in medications like Benadryl, Dorminid, and others, is a common choice. But what few know is that this compound, despite seeming harmless, can seriously affect the brain. That's because it crosses the blood-brain barrier, a natural protection of the brain, and interferes with the action of acetylcholine, a neurotransmitter essential for memory and cognition. Acetylcholine is like a communication bridge between neurons. When this bridge is blocked, the result can be memory loss, concentration difficulties, and even mood changes. And the more frequent the use of diphenhydramine, the greater the damage. Many older adults use this medication regularly, mainly for sleep, without realizing the impact it can have in the long term. This side effect is so serious that in some countries, restrictions on prolonged use in older people are being discussed. Studies show that continuous use of anticholinergic medications, like diphenhydramine, is associated with an increased risk of developing dementia. It's not an exaggeration. The risk is real and well documented. Even in younger people, frequent use can impair mental performance, especially in tasks requiring attention and reasoning. The drowsiness caused by this medication might seem like immediate relief, but the cognitive cost can be too high. The problem is, these effects are often subtle at the start. A slight difficulty in remembering names, minor memory lapses, feeling of a scrambled mind. All this can be the result of chronic use of this type of medication. And because the drug is sold over the counter, the risk of uninformed continuous use is even higher. What starts as something sporadic to sleep better can become a trap for the brain. Number 15. Promethazine. Promethazine, widely known by the brand name Phenergan, is often used to treat allergies, nausea, and even insomnia. Its sedative effect is so strong that many people use it to switch off at night. But this feeling of relaxation may hide serious risks for brain function. That's because the medication acts on the central nervous system, reducing brain activity deeply and lastingly. Especially in older adults, continuous use of promethazine is associated with cognitive slowness. You know that feeling of mental confusion, forgetting what you were about to do or say. It can be a result of frequent use of this type of medication. And the most alarming part is that these effects are not only temporary. In many cases, reasoning abilities can be permanently affected, especially when the medication is used for months or years. Moreover, promethazine has an anticholinergic effect, just like diphenhydramine. That is, it also interferes with acetylcholine, harming the communication between neurons. This blockage significantly increases the risk of dementia in the long term. Even when used occasionally, such as on trips to prevent nausea, it can cause side effects like excessive drowsiness and difficulty concentrating. Have you ever felt slower or more confused after taking a sleeping pill? Perhaps the cause lies in the use of promethazine. What should be a relief for sleep can become a burden on your mental health. And it's important to remember, the older we get, the more sensitive the brain becomes to these effects. Therefore, care with this type of medication should be doubled. A concerning point is that Phenergan is still widely prescribed and sold without much control. It's common to see people using it as a quick fix for sleepless nights without understanding the cumulative effects. So if you have the habit of using promethazine for sleep or as an antihistamine, talk to your doctor about alternatives. Number 14. Ranitidine. For years, ranitidine was one of the world's best-selling antacids, popularly used to treat heartburn, gastritis, and reflux. Known commercially as Zantac, it seemed like a safe solution for stomach issues. But what many don't know is that this medication can also directly affect brain function, especially with prolonged use. Why? Its neurological side effects are more common than one might think. Reports of mental confusion, intense drowsiness, and memory loss associated with ranitidine began to surface more frequently. This raised an alert among health professionals worldwide. Although the main focus was the digestive system, it was discovered that the medication had the ability to cross the blood-brain barrier, affecting brain areas related to cognition and attention. With this, long-term users began to exhibit cognitive difficulties. An even more concerning detail was the emergence of suspicions of contamination with a potentially carcinogenic substance, leading to the withdrawal of ranitidine from the market in several countries. But even before the scandal, the effects on mental health were already being observed. The link between gastrointestinal medications and neurological problems seemed unlikely, but today we know that the impact is real. Have you ever known someone who used antacids regularly and began to feel more confused with memory lapses? It's possible that the cause was precisely ranitidine. Its effect may not be immediate, but continuous use can result in hard-to-reverse damage. This is further proof that even common medications should be used with awareness and guidance. Although it has been largely replaced by other acid inhibitors, ranitidine can still be found in old stocks or in compounded forms. Therefore, it's essential to know its risks. Memory problems, difficulty concentrating, and mental sluggishness may be linked to this medication. If you have used it extensively, discuss possible neurological impacts with your doctor. Number 13. Omeprazole and similar drugs. Omeprazole and other proton pump inhibitors like pantoprazole and esomeprazole are among the most prescribed medications in the world. Used to treat gastritis, reflux, and ulcers, they are seen as safe, especially by those who have been consuming them for years. But did you know that prolonged use of these medications can directly affect your brain? Yes, your stomach may improve, but your brain may pay the price. The main issue is the absorption of essential nutrients. These drugs reduce stomach acidity, which impairs the absorption of vitamin B12. This vitamin is crucial for the health of the nervous system, and when it is lacking, it can cause severe neurological symptoms. Among them, tingling, memory loss, mental confusion, and even dementia in more extreme cases. The body simply doesn't function well without this vitamin. Do you feel tired, have difficulty remembering names, or maintaining focus? If you've been taking omeprazole for a long time, there might be an explanation here. The deficiency of B12 can arise slowly, silently, and is difficult to detect initially. Many people think they are just stressed or aging, but in fact, the brain is suffering from a lack of a vital nutrient. This side effect is little discussed, but very common. Another important point, prolonged use of omeprazole is also linked to a higher risk of neurodegenerative diseases. Studies have shown that, over the years, those who make continuous use are more likely to develop dementia. This doesn't mean that the medication should be avoided entirely, but rather that its use should be temporary and closely monitored by a professional. Remember, the immediate relief from heartburn can be costly for your mind if not done responsibly. Discuss the ideal duration of use and alternatives that preserve both your digestive health and your mental health with your doctor. Number 12. Diazepam. Diazepam, popularly known as Valium, is one of the most used medications to treat anxiety, insomnia, and even panic attacks. It belongs to the class of benzodiazepines, which are medications with a strong calming effect on the central nervous system. In the short term, it may seem miraculous, promoting relaxation, sleep, and tension relief. But in the long term, its impact on the brain is concerning and often irreversible. Continuous use of diazepam is associated with diminished concentration ability, difficulty forming new memories, and slowed thinking. People who use this type of medication for months or years often report a sensation of a foggy mind, frequent forgetfulness, and even mental confusion. And the most frightening, these symptoms can persist even after stopping use, especially in older adults. Studies indicate that benzodiazepines significantly increase the risk of developing dementia, including Alzheimer's disease. The reason lies in how they affect neurotransmitters responsible for brain plasticity. By repeatedly suppressing brain activity, these medications weaken neural connections, and without strong connections, the brain loses its ability to adapt and learn. Moreover, diazepam can lead to dependence. Many people start with a small dose, and over time need larger doses to achieve the same effect. This tolerance process is treacherous. While the person feels they need the medication, the brain is continuously intoxicated. It's a vicious cycle that traps the user in a routine of sedation and cognitive decline. Have you ever felt emotionally apathetic, with less desire to engage in activities that were once enjoyable? Or noticed that your cognitive responses are slower? These could be direct signs of prolonged use of diazepam. Even in younger people, the effects on memory and focus are real and underestimated by many professionals. Number 11. Clonazepam. Clonazepam, widely known by the commercial name Rivotril, is perhaps the most prescribed benzodiazepine in Brazil. Widely used in the treatment of anxiety crises, insomnia, and epilepsy, it is considered a true, popular sedative. But behind this widespread use hides a series of serious side effects, especially on cognition. And unfortunately, its impact on the brain is deeper than many imagine. Like diazepam, clonazepam depresses the central nervous system. Over time, this repeated action can seriously compromise the formation of new memories. It's as if the brain were permanently numbed. Frequent users report a sensation of mental slowness, difficulty thinking clearly, and memory lapses. In older adults, the risks are even higher and more dangerous. Prolonged use of Rivotril is associated with decreased brain activity in areas responsible for attention and learning. In some cases, it can even lead to atrophy of certain brain regions, contributing to the development of dementia. This is particularly worrying considering that many patients use the medication continuously without strict medical supervision. Another alarming aspect is the time clonazepam remains in the body. It has a long half-life, meaning it remains active for many hours and even days. This means that, often unbeknownst to the user, the brain is constantly under the sedative effect of the medication. In the long run, this continuous exposure undermines the responsiveness of the nervous system, creating both physical and emotional dependence. Have you ever felt that you need Rivotril to sleep or calm down? Have you had difficulty stopping its use, even knowing the risks? This is the dependency trap this medication can create. And the most concerning part is that many doctors prescribe it without warning about the cumulative effects on mental health. The immediate comfort does not compensate for the silent damage to cognition. Therefore, it is crucial to rethink the continuous use of this medication. There are safer alternatives, from psychotherapeutic treatments to natural supplements and lifestyle changes. The goal is not to demonize Rivotril, but to alert that its indiscriminate use can be costly, especially for your memory and mental clarity. Number 10. Oxybutynin. Oxybutynin is a medication primarily indicated for treating urinary incontinence, a common problem among the elderly. However, few know that while it alleviates urinary symptoms, it can cause serious side effects on the brain. This occurs because oxybutynin has an anticholinergic action, meaning it blocks acetylcholine, a neurotransmitter essential for memory and attention function. This interference with acetylcholine can result in mental confusion, forgetfulness, and difficulty maintaining focus. People who use the medication continuously often report a sensation of a blank mind, difficulty learning, and memory lapses that become more intense over time. And seriously, these effects are more common precisely in the population that most uses the drug, older adults. Scientific studies show that medications with anticholinergic action, like oxybutynin, are linked to a significant increase in the risk of developing dementia. The explanation is simple. By reducing the activity of acetylcholine, these drugs weaken neural connections, compromising brain plasticity and accelerating cognitive decline. It's like gradually turning off the lights of a city until it's in the dark. Have you ever heard someone say they started forgetting things after beginning treatment for incontinence? Well, the cause may be in the medication itself. And because memory loss is often attributed to age, the real origin of the problem, prolonged use of oxybutynin, is rarely investigated. This lack of information results in the medication continuing to be used without proper precautions. Another point to highlight is that the side effects are not limited to memory. Oxybutynin can also cause drowsiness, dizziness, and even delirium in some cases. This is especially dangerous for those with a history of neurological problems or who take other medications with similar effects. The interaction between medications can further intensify the risks. Number 9. Scopolamine. Scopolamine, found in medications like buscopan compound, is widely used to relieve intestinal cramps and abdominal pain. Its antispasmodic effect is effective, especially in situations of intense gastrointestinal discomfort. But what many don't know is that while it calms the intestines, this medication can also compromise brain health. And this happens because of its anticholinergic action. Like other medications in this class, scopolamine blocks acetylcholine, a vital neurotransmitter for memory, focus, and learning. This interference can cause anything from mild confusion to intense episodes of disorientation, especially in older adults. And these symptoms are not rare. In hospital settings, it's common to see older patients exhibiting delirium or agitation after using medications with scopolamine. The most feared side effect is the progressive loss of cognitive capacity. When used frequently, 𝘿𝙑𝙾 can seriously impair short-term memory. And what is even more worrying, many people use this medication routinely without imagining that it is contributing to a silent mental decline. This is particularly serious when there's a family history of dementia or other neurological disorders. Have you ever experienced episodes of forgetfulness, confusion, or a feeling of a foggy mind after taking medication for stomach pain? 𝘿𝙑𝙾 might be behind it. And since it is combined with painkillers in the buscopan compound, the effect on the central nervous system is even more intense. The combination of sedation and neurotransmitter blocking creates a state that, over time, can seriously affect brain function. Another alarming factor is that being a common medication, 𝘿𝙑𝙾 is rarely associated with neurological risks. This leads people to continue using it indiscriminately, believing they are doing something safe. The problem is, the more frequent the use, the greater the accumulation of negative impact on the brain. And the older one gets, the more sensitive the body becomes to these effects. Number 8. Dextromethorphan. Dextromethorphan is a common ingredient in cough syrups, easily found in pharmacies, and often considered harmless. However, its impact on the brain, especially when used repeatedly or in high doses, is concerning. What seems like a simple cough relief can turn into a silent threat to mental and cognitive health. This compound acts on the central nervous system, inhibiting the cough reflex, which is great for someone with a cold. But at the same time, it can cause mental confusion, altered perception, and even psychotic symptoms in cases of abuse. There are reports of people experiencing hallucinations, disorientation, and a feeling of being out of body after taking higher doses of dextromethorphan, even in syrup form. When used regularly, dextromethorphan can compromise cognitive capacity, affecting memory, reasoning, and focus. In young people, this can result in poor academic performance or difficulty concentrating. In older adults, the effects are even more intense, potentially accelerating existing dementia conditions or inducing episodes of acute confusion, also known as delirium. And it all can start with something as simple as a cough syrup. Have you ever noticed someone becoming more confused, slow, or with altered behavior after using cough medicine? That could be the effect of dextromethorphan. The brain isn't built to handle substances that repeatedly alter its chemical circuits. And while the symptom of the cough may improve, the price paid for mental clarity may be too high. Another aspect that worsens the situation is the recreational use of dextromethorphan by young people and teenagers. When ingested in large amounts, it can cause effects similar to hallucinogenic drugs. This practice, known as robo-tripping, puts the brain at risk and can cause irreversible damage to mental health. What starts as fun can end in dependency, psychotic outbreaks, or cognitive loss. Therefore, when dealing with persistent cough, look for safe and effective alternatives. Medical monitoring is essential to treat the cause of the symptom, rather than masking it with substances that impact the nervous system. Number 7. Hydroxyzine. Hydroxyzine, found in medications like 𝙤𝙤 and 𝙤𝙤𝙤𝙧, is an antihistamine used to treat allergies, itching, and even mild anxiety. With its sedative effect, it might seem like a comfortable choice for those looking for relaxation or a better night's sleep. However, this tranquilizing effect comes at a high cost to the brain, especially when use becomes frequent or prolonged. Hydroxyzine acts on the central nervous system, reducing overall brain activity. This causes drowsiness, but also affects areas responsible for attention and the formation of new memories. In other words, the person sleeps better, but wakes up with difficulty concentrating, thinking clearly, or remembering important details. And this tends to intensify with the duration of use. The impact is even more noticeable in older adults who are more sensitive to the sedative and anticholinergic effects of hydroxyzine. In many cases, continuous use leads to mental confusion, slowed thinking, and even loss of autonomy in daily activities. Even in younger adults, prolonged use can create a sensation of a blacked-out mind, affecting performance at work and in studies. Have you ever used an allergy medication and felt like your brain was turned off the next day? Hydroxyzine might be behind it. Although effective in reducing allergic symptoms and inducing sleep, it interferes with neurotransmitters broadly, creating a state of numbness that goes far beyond the expected relief. This type of sedation isn't natural, and in the long term, it exacts a toll. An additional risk of hydroxyzine is that it can be combined with other sedative drugs, like benzodiazepines, enhancing side effects and increasing the risk of respiratory depression and severe cognitive impairment. This combination is particularly dangerous for people with other comorbidities or who are already using multiple medications. If you frequently take hydroxyzine, consider safer, less aggressive alternatives for the brain. There are modern options for treating allergies without causing intense sedation, as well as natural therapies for anxiety. Assessing the effects the next day is essential to understand the real impact of this substance on your mental well-being. Your mind deserves attention and care, even in the face of seemingly simple problems. Number 6. Metoclopramide. Metoclopramide, popularly known as Plasol, is a widely used medication to treat nausea, vomiting, and gastrointestinal discomforts. In many households, it's one of the first remedies used when feeling unwell. But what few people know is that this medication has a significant potential to cross the blood-brain barrier and directly affect the central nervous system. By acting on the brain to inhibit the vomiting reflex, metoclopramide can also alter the functioning of neurotransmitters, especially dopamine. This alteration can cause unexpected neurological symptoms such as agitation, drowsiness, confusion, and in more severe cases, symptoms similar to Parkinson's such as tremors, muscle stiffness, and involuntary movements. This adverse effect, known as drug-induced Parkinsonism, is more common than one might think. In older adults, the risks multiply. Repeated use of Plasol can lead to episodes of disorientation, memory loss, and altered behavior. In some cases, the mental confusion is so intense that it resembles delirium episodes. And because it is considered a light or safe medication, many end up taking it without medical guidance, accumulating its effects silently in the brain. Have you ever seen an older person becoming disoriented after taking medicine for nausea? Metoclopramide might be responsible. It seems harmless, but its impact on cognitive health is profound. Continuous or high-dose use can leave sequelae that affect reasoning, motor coordination, and even speech, especially in patients predisposed to neurological disorders. Moreover, Plasol can interact with other medications that also act on the dopaminergic system, increasing the risks of adverse reactions. Those who already use antidepressants, antipsychotics, or Parkinson's medications should be particularly cautious. The overlap of effects can intensify mental confusion and cause severe neurological reactions. Number 5. Sinerazine and Fluorizine. Sinerazine and Fluorizine are medications commonly prescribed to treat labyrinthitis, vertigo, and migraines. Their action primarily occurs in the brain's calcium channels and the vestibular system, which controls balance. But despite the promise of stability and relief from dizziness, these medications hide a serious risk. They can compromise mental functioning over time. Both substances are associated with the emergence of extrapyramidal symptoms, that is, reactions that affect involuntary body movements. These effects include muscle stiffness, tremors, slowed movements, and, in extreme cases, disorders similar to Parkinson's. But that's not all. Sinerazine and Fluorizine can also impair memory, attention, and mental clarity. Long-term users report feelings of apathy, slow thinking, and difficulty concentrating. These effects are often underestimated because they are confused with symptoms of aging or stress. But the truth is, in many cases, they are caused directly by the continuous use of these medications, which significantly alter brain activity. Have you ever noticed someone who, while treating labyrinthitis, began to forget more or had slower thinking? That might not be a coincidence. Fluorizine and Sinerazine are known to cause this type of adverse effect, especially in older patients or those with a history of depression. In some cases, they can even trigger depressive episodes or worsen anxiety conditions. Another concerning aspect is that these medications are prescribed continuously, with many patients taking them for months or even years without a break. This prolonged exposure increases the risks of brain damage, and unfortunately, few doctors monitor these signs in time. The brain is affected little by little, until the symptoms become clear and difficult to reverse. So, if you use Sinerazine or Fluorizine, be aware of the cognitive signs. Number 4. Valproic Acid. Valproic acid, also known as sodium valproate, is a powerful medication used in the treatment of epilepsy, bipolar disorder, and migraines. It regulates the brain's electrical activity, helping to prevent seizures and stabilize mood. But its effect on the central nervous system doesn't come without consequences, and many of them directly affect cognition and mental capacity. One of the most frequent side effects of valproate is cognitive slowness. Patients using this medication often report slower reasoning, difficulty finding words, memory lapses, and a sensation of mental fog. Even at therapeutic doses, the drug can reduce performance in activities requiring attention, processing speed, and short-term memory. Prolonged use of valproic acid can also affect motor coordination and cause tremors, making simple daily tasks challenging. In some people, the impact is so significant that it directly interferes with quality of life, affecting work, studies, and even personal relationships. These symptoms are often confused with effects of the treated disease itself, but they actually come from the medication. Another alarming point is valproate's potential to affect liver function and, with that, intensify brain problems. When the liver is overwhelmed, the risk of hepatic encephalopathy increases, a condition in which toxins build up in the blood and affect the brain. This risk is higher in older adults and people with liver problems, who should be closely monitored during treatment. Have you ever felt mentally tired with less clarity of thought since you started taking a medication for epilepsy or migraines? Valproic acid might be responsible. Although effective in controlling seizures, it also has a cognitive cost that cannot be ignored. Therefore, regular monitoring with blood tests and neurological evaluation is essential. If you use valproic acid, talk to your doctor about ways to minimize side effects. In some cases, it's possible to adjust the dose or even switch to another medication with less cognitive impact. The most important thing is to remember that your mind needs to be fully functional, and that should be a priority in any treatment. Number 3. Codeine. Codeine is a mild opioid analgesic, often used to relieve moderate pain and suppress coughs. It is present in various syrups and combination medications, considered a relatively safe option for occasional use. However, when used frequently or for long periods, this substance can pose a serious danger to the brain and mental health. By acting directly on the central nervous system, codeine promotes sedation, relaxation, and pain relief. But these same effects also compromise mental clarity, concentration, and the ability to form new memories. In many cases, users report feelings of slowness, apathy, and difficulty maintaining attention on simple tasks. The brain enters a state of numbness that, over time, becomes constant. The risk increases even more with the potential for dependence. Codeine, being an opioid, can lead to tolerance, that is, the need for increasingly larger doses to achieve the same effect. This escalation in use intensifies the sedative effects and, in extreme cases, can cause episodes of mental confusion, depression, and even hallucinatory behavior. The cumulative impact on cognition can be devastating. Have you ever known someone who started using codeine-containing syrup and ended up dependent? This path is more common than it seems. And because these medications are sold in pharmacies easily, many people end up using them long-term without realizing the damage. What seems like a solution for pain or cough turns into a serious problem for brain function. In older adults, the use of codeine is even more concerning. The slow metabolization of the medication can lead to prolonged sedation, increasing the risk of falls, delirium, and memory loss. The mental confusion can be so intense that it is confused with the early signs of dementia. The truth is that the medication is shutting off the brain little by little, day after day. Therefore, if you or someone close uses medications containing codeine, it is crucial to evaluate the real need and seek safe alternatives. Number 2. Topiramate. Topiramate is a medication used to treat epilepsy, prevent migraines, and in some cases, aid in weight control. It is effective in its clinical purposes, but its impact on the brain goes far beyond what one might imagine. Even at therapeutic doses, topiramate is known to cause profound cognitive side effects, which directly affect the quality of life of patients. Among the most common effects are mental confusion, speech difficulties, memory loss, and slowed thinking. Patients report a sensation of a locked mind, difficulty expressing themselves verbally, and even problems performing simple everyday tasks. These symptoms are not rare. They are practically expected in those who start using the medication, especially at higher doses. Have you ever tried to remember a common word and it simply vanished? Or started a sentence and couldn't finish it? This type of cognitive failure is common among users of topiramate. The brain seems to operate at a slower frequency, with less agility to process information and form reasoning. This affects performance at work, in studies, and even in social relationships. The most alarming aspect is that these effects can intensify over time. Although some patients may partially adapt to the medication, others report progressive worsening in cognitive function, even with controlled use. And the risk is even greater in older adults or people with a history of neurological problems who already have greater brain vulnerability. Another critical point is that topiramate can affect mood, causing symptoms of depression, irritability, and even suicidal ideation. This emotional impact combined with cognitive slowness creates a concerning picture that compromises the overall well-being of the patient. It is essential that the use of the medication is closely monitored by a health professional with regular evaluations of mental function. Number 1. Antispasmodics. Pinivirium bromide, known commercially as Dystel, is an antispasmodic used to treat intestinal discomforts, such as those of irritable bowel syndrome. It is considered a safe and discreet medication without the intense sedative effects of other drugs for the gastrointestinal tract. However, even with its milder profile, pinivirium bromide can affect cognition, especially in sensitive individuals or older adults. Like other antispasmodics, it may have mild anticholinergic action. And as we've seen throughout this video, any interference with acetylcholine can compromise memory, attention, and thought fluidity. Even though the effects are more discreet than in more potent medications, they can accumulate over time, especially if the person uses the drug chronically or combines it with other drugs that affect the nervous system. Have you ever noticed memory lapses or difficulty concentrating after starting treatment for abdominal discomfort? It might not be a coincidence. Even a medication considered mild can interfere with the brain's chemical balance, especially if the body is weakened or aged. Another important point is the interaction with other medications. Since pinivirium bromide is commonly used by people who also take antidepressants, anxiolytics, or antacids, the risk of overlapping cognitive effects is real. This makes careful clinical evaluation of the patient even more important, with attention to brain function and neurological history. It is crucial to remember that there are other ways to treat irritable bowel and gastrointestinal spasms that do not involve this type of chemical interference. Changes in diet relaxation techniques, fiber use, and even herbal therapies can offer relief without risking mental clarity. Intestinal health is essential, but it cannot be achieved at the expense of brain health. Therefore, if you frequently use antispasmodics, talk to your doctor. Re-evaluate the real need for the medication and consider alternatives that preserve your ability to think clearly. In any treatment, the balance between benefits and side effects must be constantly reassessed, and your mind should always be at the center of that equation. And remember, all the medications mentioned in this video can only be used under medical prescription, and you should not stop using them without your doctor's permission. Listen to the health professional, always. And if you want to continue receiving the best videos for your health, subscribe to the channel, because it exists for one simple reason: to make you a healthier person with a better quality of life. Helping you is my mission. In the video that appears now on your screen, I reveal the 5 silent villains that destroy your muscles. Click on the screen and check it out. So, see you in the next video.